The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Today is Friday, October 28th. I'm Donna Will, Professional Development Coordinator for the Central Maryland Regional Office of the Maryland Developmental, oh my goodness, Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the monthly series of DDA updates with Deputy Secretary Bernie Simons. On the panel today, we have Bernie Simons, Deputy Secretary for the DDA, Nick Burton, Director of Programs, Rhonda Workman, Director of Federal Programs and Integrity, Jennifer Metrick, DDA, QIO with Liberty Healthcare Corporation. And before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone. And if you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. There's one handout for the webinar, which can be downloaded from the handout section, or if you are listening by phone, you can request that they be emailed. We will be recording the webinar and posting this session on YouTube and the DDA website. Today's PowerPoint has also been uploaded as an attachment and is available for you to download in the webinar panel. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. Now I'd like to introduce Deputy Secretary Bernie Simons. Good afternoon.
Good afternoon. Can you hear me okay, Donna?
Yes, I can.
Okay, so I want to thank everybody for joining us again. It looks like we got an excellent turnout. And, and I look forward to sharing some important updates with you. Today's agenda, obviously, we'll talk about LTSS Maryland-DDA module and the expansion. You're going to hear from Nick, as Donna just said. He'll be talking about National Disability Employment Awareness Month, the DSP recognitions, the National Family Caregivers Month, and the Community Settings Rule. So he's got a lot to cover there. And then Rhonda Workman from our federal programs will summarize where we are with the Appendix K flexibilities, as we know that was extended, as well as unwinding, and then talking a little bit about self-directed services. And then Jennifer Metrick will close out with the quality improvement organizations, and then we'll get into some questions. Next slide, please. So the DDS module is an important part of our transformation, and everybody knows that when the legislation was passed and basically said you need to change your model for businesses and the way you do it and go into fee-for-service, and we knew that PCIS2 was not going to accommodate that. So the LTSS Maryland-DDA module is extremely important to us. And this is an IT platform that is basically specifically for DDA, but it's the whole overall platform is Medicaid. And many of you know and have engaged with the staff from the department with the MPS group. So again, this will deal with eligibility, waiver applications, service plans, provider billings, etc. And it will replace this old system that we have that's been around, and it's a legacy system that we really need to move into something that's much more user-friendly for everybody. Specifically with, responding to individuals and families about wanting flexibilities to do multiple services throughout the day. And, we know that there's a lot of limitations in PCIS too. So with the ongoing support of our partners within the department, Medicaid, et cetera, the DDA regional offices, case management entities, providers, we've been transitioning, as you know, for a period of time now, and it's been very, very positive and outcoming, and it's been extremely supportive with the collaboration and cooperation and the communication that everybody's had. So most recently, as you know, we started way back when with the early adopters and the pilot providers, and then last April through this September last month, we worked with about 55 providers who are interested in successfully transitioning in either partially or all of their services and billings into at the LTSS model. And so far, over $100 million has been billed by these providers and paid. And I want to stress and paid because the industry basically says that the rejection rate on a claim that goes in and then gets bounced because it doesn't pass for whatever reason. We know we've seen some of that with the addresses not being correct or whatever, and matching, that's about a 5% error rate. And you guys have done outstanding between case management, the provider agencies, the regional offices, et cetera, because obviously those person-centered plans have all of this information in there that the providers bill against. And we are at 2.2%, not even close to being 5%. So again, I think you guys have done an outstanding job with moving our system forward. And again, I want to thank our early adopters and pilot providers who have helped shape this transformation. And, we've learned a lot about, the essentials of readiness factors, planning for provider billing transitions, because it's different, obviously, in LTSS than what we do in PCIS2, and then the ongoing support for all of the providers post-transition. So it's not like, we're here, we're helping you, we get you off and going into billing into LTSS, and then, we need to continue to give you support, as you need it for your agencies. So I'm appreciative of the interest and the willingness of all of our providers in case management, to make all of these transitions. It's really been a heavy lift. And I want to specifically recognize the contributions of our valued early adopter group of Penmar, Seek, Abilities, Jubilee, and Make 'em Life. So again, this was, they were the early adopters. They were early on, and they set the stage, and all of those agencies are in 100%. Excuse me. So with this progress that we've seen in moving forward and Secretary Dennis Rader's leadership, we're going to be moving forward and working with you guys individually with each agency and each provider, and what that transition will look like for your agency. And we'll begin that in January of 2023, and that will end in a 2-year cycle. So it's all of 23 and all of 24. Next slide, please. So our confirmed 24-month timeline, again, as I just said, will kick off with interested providers who've been working with the regional offices and their transition in early 2023. This timeline also considers providers who are still evaluating their readiness. What do I need to do? It's different. I've got to do different practices in my business office, et cetera. I need to figure out how to capture the data, et cetera. So the regional directors will be in the process of reaching back out to all of the providers to discuss your support and the interest in moving forward and where you think you are with your readiness. So having said that, people who are in 100% are good. Those who are in partially obviously have some familiarity with LTSS in the system. And then we have a group of providers who don't do any billing at all. But, even the providers who are in partially, you still need to make sure that all of the people who are still in PCIS2 and then will be transitioning billings to LTSS, that their person-centered plans are accurate, so that that's how the provider can get paid and keep us at our 2.2% error rate, et cetera. And so what we're going to do is on November 16th, we're going to have a day for collaboration between the providers and case management, and DDA will be hosting this. And, we want to make sure that we've got, what lessons learned and best practices and what the expansion timelines will look like and available resources. So, I invite you to attend that. Please register and click on the link. And I believe earlier today there was an announcement that went out through Constant Contact that announced what the day would look like, starting with 9 o'clock in the morning to 10, and then I'll do introductions at 10, and then we'll go throughout the day. So having said that, I know I went quickly through a lot of this. It's a lot of information. It's really positive. I'm really excited about the way that people have worked together, the progress we've got, the exceptions being so low. I mean, that's always been the conversation about, what happens if the provider bills and the billings don't go through, and, then they don't have it. They have a cash flow problem, et cetera. We have not, the providers have not experienced that. That's been a positive story, and it's truly all of the hard work of case management, the providers, and the regional offices. So again, I thank you for all that you're doing, and now I want to introduce Nick and have him give a summary of all the accomplishments and talk about the community setting tool, et cetera. So thank you.
Thanks, Bernie. Donna, can you go forward to the next slide and then the one after? Perfect, thank you. Stay here for a moment. So as we close out National Disabilities Employment Awareness Month, let's continue to carry forward the theme for this year: disability, part of the equity equation. As a person-driven system, we are committed to an equitable approach to help people with developmental disabilities as they create their good life. We wholeheartedly believe in the role people with disabilities play in making the nation's workforce stronger, more resilient, and diverse. On October 4th, 2022, the DDA received an award at the State Employment Leadership Network Conference for our use of data to inform policies and practice that promote employment. Thank you to all of you that contribute to that data collected each year. It's very much appreciated, and you can see here on the slide that we have our award. Please also check out our DDA Facebook page, as we highlighted people that have been successful in obtaining competitive integrated employment within our communities. Of course, it was not everybody, but it was a good snapshot of some of the folks that wanted to share their story. And you can see a picture here of one of those individuals who is an artist and has done some beautiful, beautiful artwork. So again, I just want to thank everybody for their commitment to Maryland being an employment first state. It's important that I think we all continue to live those values throughout the year. Donna, next slide. So in September, we celebrated Direct Support Professionals Week, and over the past month, we were able to partner with the Department of Disability to recognize outstanding DSPs across the state that were nominated by their peers, colleagues, and people they're working with. The DSPs that were nominated got a certificate of appreciation and were able to come together at provider-hosted celebrations across the DDA's 4 regions. Pictured here are just some of those nominees. I think I can speak for all of us when I say that DSP Appreciation Week is one of our favorites. And in all reality, we thank and celebrate the hard work of DSPs every single day. So, I want to thank DSPs and have you thank your DSPs for all of us. And thank you for making such an impact to the people that we support. Next slide. So a new month is coming up, and November, which is hard to believe, but it is National Family Caregivers Month. And I think we just want to say thank you to all of our family members who are caregivers for their children, siblings, nieces, nephews, and all other familial relationships that exist out there. Our own family support director, Marianne Kane-Bresci, is a member of the Commission on Caregiving, and they are hosting a virtual event with author and radio host Peter Rosenberger, who has been a caregiver for his wife for the last 33 years. This is a virtual celebration of caregivers, and it's going to be on November 9th from noon to 1:30. In addition, throughout the month, DDA will be sharing via social media different videos pertaining to state services that support caregivers, which include MD TAP, DDA's LIST program, the National Family Caregiver Support Program, and the DHS Respite Care Program. So again, you know, I think families and those that are providing care for the people, their loved ones, it's important to recognize the contributions that they are making to the people in their lives. Next slide. All right, community settings role. So I just have to say, we collectively have made fantastic progress in relation to the community settings rule. So as of yesterday, and the last update I received, we are in single digits regarding settings that are non-compliant, and our office is working closely with those settings to make sure that they come into compliance. So I just think this demonstrates the shared values that our system has towards people's autonomy and their desire to live full lives in their local community. And I just want to say we really appreciate all the suggestions and feedback we've received related to the CSR framework and the community settings questionnaire that we received at our webinar a couple months ago. I think it's really put us on a really great path. The CCS CSQ training is going to be shared with CCS Community Practice and CCS Leadership, hopefully within the next week or two for review and feedback. And then we will finalize and begin rolling out to the CCS soon after that. The guidance we've created on the community settings rule has been through an internal review, and I'm going to be pulling together a small group of stakeholders to review and provide feedback before we finalize and release. We want to make sure we got that right. We want to make sure we incorporated the feedback that we've received from all of you. So it's going to be important to get that feedback. The department, per my understanding, is going to be issuing compliant and non-compliant letters by the end of October. Again, that is non-compliant settings are in the single digits for us. So the vast majority of our settings are considered to be compliant. Any non-compliant setting right now, you are engaging with your regional office and working to resolve those things. So that is not going to be a surprise to you. And hopefully those get resolved as quickly as possible, if not have already been resolved since I got an update yesterday. So again, this was such an amazing effort across the board over the last few years, over the last couple of months, to make sure we got this right and to make sure that we continue to get it right as we move forward. And again, I just thank you so much to everybody that has been a part of this process. So I'm going to turn it over now to Rhonda Workman, our Director of Federal Programs and Integrity. Rhonda?
Thanks, Nick, and happy Friday to everybody. Donna, you can go to the next slide, please, and one more, please. Thank you. So today we wanted just to share some updates and reminders related to the Appendix K flexibilities and unwinding. This slide is specifically related to it. The department has extended the flexibility associated with the waiving of high school diploma or GED requirements through January 31st of 2023. A communication went out this week related to that. And so we've also updated the unwinding chart, which is on the website. In addition, we wanted to let you know that the department has also submitted an Appendix K amendment to the Center for Medicare and Medicaid Services to do a few things, including ending the Appendix K residential retainer days with an effective date of September 30th, 2022. This will provide opportunities for our residential providers to access those residential retainer fees up to 18 days per calendar year under the normal waiver authority. In addition, our amendment is to clarify additional reasons for the rate increase due to isolation. For example, that we have already noted in our guidance is that increased rate for isolation could be used for participants when they're symptomatic, waiting for test results, and also for participants when they're discharged from a hospital. In addition, we're clarifying staff training related to the flexibilities continuing as per our unwinding strategy. And then lastly, we're also requesting to increase some of our reserve category slots to support the people that we were able to get enrolled during the period of time. Next slide, please. I'd like to also offer some updates related to our self-directed services. In particular, this slide is related to our background check requirements. And as you may know, we have been sharing that our financial management and counseling services, agencies or providers referred to as FMCSs, are required to ensure that current and new self-directed employees meet program requirements, and this includes the background checks. The update that we've made to our guidance and are announcing today is that participants self-directing their services will determine the type of background check they want for their employee. A communication went out earlier this morning. In addition, we have updated the guidance on our website so that you can review for further information. It's important that participants have information about the options so they can make an informed decision about which best supports them. We have noted, as per the waiver requirements, that there are two types of background checks. The first one is a Maryland state-only criminal history check, and the second one is a national criminal history check. On the next slides, we're going to provide some additional information related to these types of background checks. Next slide, please. In terms of the Maryland state-only criminal history check, this check is conducted by fingerprinting through the Maryland Department of Public Safety's Criminal Justice Information System, also referred to as CJIS. This background check will reveal criminal activity conducted in the state of Maryland only. It will also provide alerts if an employee engages in criminal activity in Maryland only. The second type of background check is for a national criminal history check through a private agency that the FMCS contracts with. This type of background check will reveal any criminal activity conducted in the states that that employee lived or worked in the last 7 years. This type of check does not include fingerprinting, and therefore information is based on the date of the check alone. There are no alerts if any new additional criminal activity occurs. Next slide, please. This slide provides a few more important details associated with this new option for participants to select which background check they would like. The choice of the background check applies to participants clearing employees for work after November 1st, 2022. The FMCS agencies may have conducted background checks on employees during the FMCS onboarding process. Those background checks do not need to be completed again. FMCSs are responsible for paying and conducting the initial background check on all employees. Participants may request for their employees to complete additional background checks during their employment, such as on an annual basis. Subsequent checks could provide updated information and must be equitable across all employees. As this is an option based on the choice of the participant will be responsible for the cost of subsequent background checks by using their current authorized funds. And as I mentioned, the DDA has updated our guidance related to the FMCS transition timesheets, invoices, and background checks, which is noted on our dedicated FMCS webpage. Next slide, please. The second update that we wanted to share, which is also noted in the updated guidance, relates to the FMCS transition. In June of 2022, the department announced the new FMCS providers and transition plan for current participants' self-directing services. In order to make an informed decisions, information has been shared about the available FMCS providers, services, and fees, including in-person and virtual information fairs. This slide also includes a link to the final virtual fairs conducted this week with available links so that you can review. During the open enrollment period, current participants will select from available FMCS providers and indicate their choice on a dedicated form. They had two options for dates to choose. The first was the October 1st, 2022, and the last is January 1st, 2023. Next slide, please. We're happy to share today that as of October 26, 2022, 1,691 participants have made an FMCS choice. That is 89%. That means we have a remaining 201 or 11% of the participants still in need to make a choice. Choices are made daily, and these numbers have already changed, where we have already achieved over 90% of our participants making a choice. Information regarding the FMCSs can be viewed on the DDA's Financial Management and Counseling Services website, in addition to each of the FMCS's dedicated websites, including GT Independence, Public Partnership LLC, and the ARC Central Chesapeake Region. It's important to again note that current participants who do not select an FMCS provider by November 15th will be randomly assigned an FMCS provider. Again, we encourage all stakeholders who have not made that selection to view our virtual webinar conducted this week, visit our website, reach out to your coordinator of community services and your team, and the DDA if you need additional information so that we can support you and you can make that decision. Next slide, please. And lastly, the update related to changing FMCSs after initial selection. We've updated in our guidance that the participant can request a change in FMCS at any time during the year. The effective FMCS change date must give the outgoing and incoming FMCS agencies at least 30 calendar days notice of the change in provider. The 30 days will support the onboarding of the participant and their employees, vendors, and providers with the new FMCS. Now we welcome back Jennifer Metrick, DDA's QIO of Liberty Healthcare Corporation, to provide some updates about the Quality Improvement Organization program, our National Core Indicators surveys, and the Council on Quality Leadership Network Accreditation webinar coming up in the next month. Next slide, please.
You can go to the next slide. Thank you, Rhonda. Good afternoon, everyone. Thank you for including Liberty in today's webinar. Today, I'll be providing an update on the most recent activities of the QIO and what's up next. You can go to the next slide. So as a reminder, QIOs are here to help states and people served through their state service delivery systems in the following ways. QIOs ensure people who receive supports and their families have an opportunity to share their experiences and ideas for improvements. QIOs also bring proven methods to discover where is a system we're doing well and where are those areas in which we can improve. And finally, QIOs take the information they've learned through discovery to recommend best practice changes so that people can receive the best possible supports leading to fulfilling lives. You can go to the next slide. As a quick update on the 3 areas of the QIO work that we'll be doing with the DDA, we first have the data collection for the Council for Quality and Leadership's Network Accreditation. We will be having a webinar later in November that will talk about all of the components of the CQL network accreditation, what that means for our Maryland system, to participants, to providers, and to all those that are involved in that process. So we'll be walking through that, and I have a slide a little bit later to give a little more detail. We also will be launching the National Core Indicator Survey Data Collection, and I'll talk a little bit more about that and what to expect from that data collection. And then we also, through our monitoring of waiver assurances, we will be piloting 2 of our tools that we've been developing that will be part of that process: our targeted case management review, as well as our financial accountability and or utilization review. So I'll talk a little bit more about that piloting and what that means. You can go to the next slide. All right, so here is a postcard that waiver participants will be receiving if they are selected to be part of the National Core Indicator Survey's adult consumer interviews. So there will be over 1,600 participants that will be selected as part of the sample for the adult consumer survey, and we'll be breaking that up into 2 phases of data collection this year. And so in our first phase, November through February, participants who will be selected in that phase will receive the postcard alerting them that we will be reaching out to see if they would like to participate in this survey and provide their feedback and their voice around the services they're receiving. And then the second phase would then be March through June. So if you receive this postcard, if you're a waiver participant on today's webinar, or you are someone supporting a waiver participant or family member, please encourage them to talk with the Liberty Healthcare team member that will be reaching out to them to talk to them about what it means to be part of this survey and if they would like to participate in it. So the next slide. So we also will be surveying families and family guardians as part of the National Core Indicator process. Family members, please be on the lookout for a letter that will be coming out in just the next couple of weeks. This letter will give you all the information you need to complete the survey, either through a QR code that you can easily do on a smartphone or smart device using a web link and your computer, or even being able to do it through a paper survey format. So here we have an easy 3-step process around how you can quickly use a QR code to be able to complete this valuable information in just a few minutes. So it's as easy as opening your camera on your smart device, being able to frame the QR code that will be on the letter that you receive, and then a link pops up, you click on the link, and you will be able to enter the NCI family survey. So we really hope to get as much participation as possible. So if you receive this letter, please pay attention and please share your voice. All right, and the next slide. So just a little bit more on the Council on Quality and Leadership's webinar that will be happening later in November. An announcement will be coming out soon so that you can save the date for this important webinar. CQL is going to be walking us through what network accreditation means for Maryland. This is going to be a 4-year process. This process includes building our capacity as a system to deliver high-quality person-centered services. It's going to provide data on people receiving services and if they are having their life outcomes met, and our supports in place for them to reach those life outcomes. So this is important impact data to show how our service delivery system is helping people to live their best lives. The process also will include monitoring of our system's quality improvement strategies over that 4-year time. This really is a journey, and they will walk us through what to expect on that journey. They also, throughout this time period, not just as part of the webinar, will be providing ongoing support to Maryland system, to the department. They'll be providing guidance, as well as providing us all of the access to the CQL resources. So you can go to the next slide. So as we've mentioned in past webinars, the QIO and DDA selected a collaborative work group to help support the development of the QIO evaluation tools and processes. So the QIO collaborative work group met for its first meeting on October 20th, just of this month. And as part of that, we did an overview of all of the QIO activities, but we really focused in on the evaluation that is related to financial accountability and utilization review. So that's looking at our claims data in Maryland and ensuring that claims are paid for within the guidance of the waivers, that they were paid for accurately, as well as looking at service documentation that demonstrates that those services were provided in accordance with the waiver and the person-centered plan. So we dove into that a little bit. We've got some great feedback from the collaborative. They are adding to that feedback now. We will be providing summary documents that we'll be putting on the QIO webpage of the DDA website in the coming weeks. We'll have a summary PowerPoint, as well as a summary of the feedback, the major themes, and some of the things that that the collaborative hopes to see as part of this process, and moving forward, particularly around educating our whole DD community around what this means and how to prepare for that evaluation process. So we'll hopefully have an upcoming webinar once we pull all of this together to be able to share all of that information with stakeholders and help people take the necessary steps in preparation. I've put a link here to the QIO page of the website that will be further developed in the coming weeks. You can go to the next slide. So as part of us preparing for what will those financial accountability and utilization review processes look like, certainly we've gotten feedback from our collaborative work group, but we also have to test out those processes and are looking for providers who are interested in participating in an initial pilot of that process to share information with us so that we're able to really examine how our process is operating and where we need to learn from areas that might need to be tweaked as part of that process. So to participate, what we're asking for is about 5 to 6 providers that would be willing to share documentation on approximately about 5 people that they support in a variety of services. As part of that participation, we would be requesting documentation on services provided from those 5 individuals around the service notes for those services, staff timesheets associated with those services, as well as documentation on staff training and qualifications at the time of the service. So if anybody is interested, please email me. My contact information is on the next slide, and we can set up time to discuss what that pilot would look like and when we would be doing this. It's very likely that that's going to happen closer to the beginning of December. We'll also be piloting our tools on our targeted case management in the coming months as well. So there's lots of work, lots of learning that we'll be doing as part of this process so that we are ensuring that we know also how to best launch these initiatives, gain feedback from the provider community, as well as being able to make sure that we have tools that are giving us the best data possible that will help move the system forward. So you can go to the next slide. And that's, I'll send it back to you, Donna.
Okay, I can just go over the webinars. Please join us for our webinars, our Friday webinars at 1 o'clock. Looks like we're not going to be having the one on November the 18th, but we will have it on December 16th. And this is a live link, and you can click on that on your handout, and that will take you to the registration. But if you've registered already, you don't need to register again. And I think we're ready for questions.
Sure. Okay. Good afternoon, everybody. I'm Dr. Smalls, Director of Professional Development. Again, thank you so much for attending today's webinar and for posting your questions in the question box. We still have room for more if you have them, so please go ahead and ask those questions. We will attempt to answer as many as we can during the rest of the time. And as always, your feedback is critical to our development, and we'll be reviewing and responding to those frequently asked questions with the updating of our DDA FAQ document. Okay, let's start with our questions. All right, our first question is, will the rate study committee be resuming evaluating meaningful day rates? This is a big reason why meaningful day only providers have not fully transitioned to LTSS. Deputy Simons, I know that you said you would be willing to answer this question.
Yeah, it's my understanding that the rate committee will be meeting again in the beginning of January, and I think we've got some members who are here as attendees. That was one of the commitments that the rate advisory committee from the state, Jennifer McElhaney, who runs that, who's the chair of it, committed to going back and taking a look at all of that.
Thanks, Deputy Simons. And there are other questions that may be relevant to fiscal, and we're going to be certain to share that with Robert White and make sure that your questions are thoroughly answered. Okay, our next question is, looking at PCIS, currently the 18 days are not listed available for October. Is this because DDA is waiting on further guidance for it to be added?
Yamanda, I'm happy to add a little bit for that, at least from the Appendix K perspective. Yes, we will wait till we get authorization from the Center for Medicare and Medicaid Services before we send out information to providers to confirm that we're able to resume those 18 days. This question will be shared with Robert related to the PCIS2 functionality in the fiscal part of that.
Thank you, Rhonda. This next question is actually for you as well. What if you had a staff already do the fingerprinting as was stated before this information was received? The receipts have already been sent to FMCS. Can we still get reimbursed?
Yeah, that's a great question. Yes, if you've already completed the background check, that's fine. You don't need to take any further action. And yes, receipts should be submitted to your FMCS as per the process and information that they provided to you.
Thank you. Okay, this next question. I understand that my daughter's CCS is responsible for submitting budget modifications to reflect the FMCS cost. I've reached out to the CCS and haven't yet heard back. What should I do? Rhonda, I'm going to kick that to you as well.
Yeah, I think actually Nick was going to answer this one.
Yeah, hi, this is Nick. So I think if you are having a trouble reaching your CCS, it's certainly okay to reach out to your CCS supervisor or the leadership structure within their agency. You can also reach out to your self-directed lead in the region who can support you and your daughter or any one of your other loved ones get the budget mod completed. You can also reach out to the regional director if you need support. So there's a variety of different resources you could access to go ahead and get a hold of your CCS as needed.
Thanks, Nick. Okay, our next question. So current self-direction employees do not need to have further background checks. Is that if the team agrees, if that's what the team agrees?
Yeah, so that's a great,
for you.
Yep, thank you, Yamanda. So yes, as we shared today, and you'll see in the guidance that we've issued, that the initial check must be completed for all current and new employees, and any subsequent checks would be the decision of the participant, obviously with support and input from their team. But if the participant decides that they don't want to have any subsequent ones while they're under that employment and associated with that FMCS, then no further action is needed.
Thank you. It looks like there are a couple questions around that issue, and I think you just answered them. So we'll move on to the next question. Okay. As a vendor for self-directed services, do we need to, it's another background check question, do we need to complete the required background checks?
Yeah, so vendors will need to complete the background check and have that available for the FMCS to demonstrate that they meet the qualifications that are outlined in the waiver. So the waiver programs will note which services require a background check, support broker being one of them. And if you're a vendor, then you would be responsible for getting that completed and providing that to the FMCS along with your certification to demonstrate that you meet the minimum requirements of the waiver.
Thanks, Rhonda. Again, there are a few questions centered around ARPA and potential increases in rate for meaningful day and other questions relevant to the fiscal team. So all of those will be sent so that there's thorough evaluation and response to you. So thank you for asking them. Our next question, okay, so general one, is it possible to consider an earlier time for the webinar? So there's some concerns about religious observations. So thank you so much for that question. And as always, we're attempting to accommodate accessibility to our constituents. So we will take that for evaluation. The next question is, given that it's getting close to submitting cost report audit, those providers that have transitioned to LTSS no longer have access to PCIS data. How can we work around this? I'm throwing that out to the team for a response.
I think, hi, Dr. Smalls, this is Nick. I think, again, that's kind of something that you're going to want to bring to the fiscal team, the DDA fiscal team, to have a discussion about, depending on what that need is, depending on when you transitioned, what that look back looks like. So I think it's important to bring that to the DDA fiscal team, okay?
Thanks, Nick. Our next question. When listing support brokers on the DDA website, can you please add a slot for the languages they speak? I have been approached to help find support brokers who speak certain languages because English is the client's second language.
Yeah, this is Rhonda. I think that's a great suggestion. I wanted to share that support brokers will be included in the new DDA provider directory that will list the different providers and options across the state, and you'll be able to sort. Nick, do you know if the provider directory includes languages that the providers are familiar with or speak?
Hey, Rhonda, I'd have to follow up with Leslie to double check that, but that's something I can follow up on, and we can certainly share as applicable with the group.
Sounds great, thanks.
Okay, bear with me, a few questions are coming in pretty fast here. The next question. Okay, as a parent who is also staff, do I need to be fingerprinted? Rhonda, that's for you.
Yeah, if you're providing services, paid services under the Medicaid program, then you would need to be fingerprinted because you would be considered a staff or employee under a Medicaid program and would need to meet those qualification requirements.
Thank you. Nick, this is for you. Is there a current list of CCS provider agency contact persons that DDA can share with the providers?
Hi, yeah, so the regional offices have that, but also the CCS agencies have that, and certainly can reach out to those CCS agencies to receive that. I think that's a good place to start to get that information. As you probably know, there's a significant amount of CCSs, and I think there is, that would be updated quite frequently. And so I think it's best to reach out to the individual CCS agency to make sure you're getting the most current up-to-date contact information.
Thanks so much, Nick. And I want to say again, thank you so much for the time that you've taken for this webinar and that you're including your questions. There's always opportunity for you to bring your concerns and challenges and questions to us, and we will attempt to answer. And as mentioned prior, we'll be updating our DDA FAQ questions list for consistency and response. I'm going to go ahead and turn it back over to Deputy Simons.
So I want to thank everybody for being here today and for your questions. We'll get some documentation out, especially around a couple of the fiscal questions that came out and some of the others. And so, again, I encourage everybody who has the time to be with us on November 16th in Columbia for that day with the case management and the provider agencies to talk about going forward. And with that, I hope everybody has a wonderful weekend, and thank you again for being here.